Assalamualaikum warahmatullahi wabarakatuh. Today we will be talking about Angelman Syndrome, a rare genetic disorder that affects an estimated 1 in 12,000 to 20,000 people worldwide. Let's begin with an overview of what Angelman Syndrome is. Angelman syndrome is a complex genetic disorder primarily caused by a genetic change in the maternal copy of the UBE3A gene. This gene is critical for brain development. In individuals with Angelman syndrome, the chromosome from the maternal copy containing this gene is either deleted or undergoes a mutation. More specifically, the disorder occurs when a segment of the maternal chromosome 15 where the UBE3A gene resides is deleted or altered. This missing or damaged part leads to the unique set of symptoms associated with the condition. As we go through this presentation, you will see how this genetic change impacts individuals and how management strategies can improve their quality of life. Let's dive deeper into the causes, symptoms, diagnosis, and management of the disease for Angelman syndrome.
Now, let's jump into the symptoms of Angelman syndrome. As for the physical structure, some may have short stature, underweight, wide mouth while smiling, deep set eyes, and pointed chin. On the other hand, for the internal features, this individual usually faces moderate to severe intellectual disability where they are not able to think, learn, and solve problems. They do require specialized teaching techniques and repetitive learning. Not only that, they tend to have developmental delays primarily in speech and motor control skills. They commonly use nonverbal communication since their words are limited. Even worse, some might not communicate at all. Next, they commonly have problems in sleep. They frequently wake up at night and it is difficult to fall asleep back. They also sleep for a short time period, which will cause them to sleepy during the daytime and make them moody. Additionally, Angelman syndrome kids may have an excitable personality with a high energy level. They seem more cheerful and hyperactive than other normal kids. Laughing and smiling are a must for them. Also, randomly, they will run and jump with their hand flapping. Other than that, throughout their toddler era, they always experience seizures. These seizures will become less frequent as they grow up. However, some may experience it throughout their life. Last but not least, the person in these cases will have issues in balancing their body while walking, standing, and while performing physical tasks. They might be diagnosed by ataxia, which lacks coordination and control over voluntary movements. Their movement might seem weird, which is they will tiptoe. That is all for the symptom of Angelman syndrome. Thank you.
Everyone, my name is Azlia. So, I will explain about genetic causes and mechanism of Angelman syndrome. Angelman syndrome causes change in a gene called a genetic change. It is most often caused by a genetic change in a gene on chromosome 15, which is UBE3A. The UBE3A provides instruction for making a protein called ubiquitin protein ligase, E3A. It plays a critical role in the normal development and function of the nervous system. Turn off, inactive, or deleted the UBE3A gene can lack of enzyme function causes Angelman syndrome that primarily affect nervous system. There are 4 genetic mechanisms of Angelman syndrome, which is first is chromosome deletion, second is paternal disomy, third is imprinting defect, and the last mechanism is UBE3A mutation. Since chromosome deletion has higher percentage than others, we focus more on it. Chromosome deletion of Angelman syndrome will have a missing or damage a part of gene happen in maternal copy. This gene normally produces UBE3A. mRNA lead to the production of E6AP, a ubiquitin ligase protein. Generally, this particular protein tags many other proteins with polyubiquitin mark. This polyubiquitin mark, represented by these yellow dots, are essential marker for degradation. Can you imagine? There is a sniper who want to kill specific person in the crowd. How does the sniper know whom to kill? And there should be a some tag, and exactly these tags are really important for protein degradation as well. By that tag, proteasome machinery kind of recognize which protein to degrade. This is how the E6AP protein is really important for proteostasis. Anyway, in this disease, UBE3A mRNA is not produced because there are problems in the UBE3A gene that lead to faulty production or reduced production of E6AP protein, and that's the key cause of this particular disorder.
We can take a look at an example of imprinting inheritance in familial Angelman syndrome, and we can see if the woman have UBE3A mutation carrier, she has a biggest chance to have children with Angelman syndrome.
Hi everyone! Let's talk about how Angelman syndrome is diagnosed. So, diagnosis this condition involves with two main steps. First is clinical diagnosis, where doctor will observe the symptom or behavior traits. And the next one is genetic testing. Let's break it down one by one. The first step is clinical diagnosis, where doctor will look for certain signs and behavior traits from the kids or babies. So the first sign that the baby show is developmental delays. Babies might not meet milestones like sitting or crawling on time. You will notice this around 6 to 12 months. The next one is for kids, is speech impairments. Kids might barely talk and might not talk at all. They will also show some behavior traits. This is unique because they tend to laugh a lot, slap their hand, and have a cheerful vibe that often called as happy puppet appearance. And the next one is movement issues. Walking might be quite tricky because of their poor coordination and balance. This is called ataxia. Next, we will look at step 2, which is genetic testing. To confirm, they will test blood samples. Here is what they do. First, methylation test. This checks for unusual pattern of chromosome 15, which often points to Angelman syndrome. And the next one is DNA sequencing. They zoom into UBE3A gene, which is a major culprit for Angelman syndrome, to see if there are any mutations. And the third one is fish test. Fancy name, right? It's like a highlighter for chromosome. If parts are missing, the fluorescence signal will be weaker or even gone. And the last one is DNA marker analysis. This checks if there are any mix-up with the maternal or paternal genes on chromosome 15. And that's how it's done. Doctors first observe the child's symptoms and then back it up with a genetic test to confirm. Together, these steps give a clear picture of Angelman syndrome.
Next is management of this Angelman disease. There is no main treatment for this syndrome. Unfortunately, in most cases, there is no way to prevent Angelman syndrome since it occurs as a result of spontaneous genetic abnormalities while the fetus is developing in the uterus. Instead, healthcare providers focus treatment on the specific symptom that each child with Angelman syndrome has. Early diagnosis and treatment are key to helping a children with Angelman syndrome maintain the highest possible quality of their life. The first one is anti-seizures medicine. This medicine is used to treat seizures in people with Angelman syndrome by controlling abnormal electrical activity in the brain. This is because Angelman syndrome is a neurogenetic disorder that causes developmental delays and often results in intractable seizures that begin in childhood. Second, prevention of Angelman syndrome is physical and occupational therapy. This can help them develop motor skills such as standing and stepping independently. It can also help improve coordination, balance, and posture. Third is behavior therapy. This therapy is to overcome the hyperactivity. A behavioral therapist can help determine the likely cause of behavioral issues such as boredom, frustration, or pain. Fourth is communication and speech therapy. This can improve the communication skills and develop strategies to communicate without relying solely on verbal communication by teaching them using a special technique that can make them interested with the learning session, like using a symbol or pictures. Fifth is sleep training and supplement. Some findings support a role for mirtazapine as a supplement in treating sleep disorder in Angelman syndrome. This can help them to manage their sleep issues because they have less sleep than the other children.